But is there such a thing as too much exercise?
Yeah, yeah. I mean, it like a lot of things, right? Some is good, more is better, but only to a point. And so, all of those curves show that there's a plateau at some point. So what you get back is much less than what you put in at the beginning or the early stages of doing something. So, and I in another phase of my life probably spent periods where I did too much and my body hurt. I became mentally, I call it stale, or I mean, it's almost depression to say, you're just dragging yourself to a workout. And so you can call it overtraining or overwork, or a lot of people call it under recovery, which I don't know which is which, but yeah, the good stuff happens in recovery. And so, one of the axioms that we do know as you get a little bit older is to make sure that you allow yourself enough time to recover from what you've done. And that's when the benefits happen.
Are there specific recommendations around how best to recover?
Probably lots and lots I could talk about around nutrition and sleep and everything else like that. But sleep is definitely regenerative time. Support yourself from a nutritional standpoint. If you're ever in a situation where you're withholding energy or anything else like that, recovery is going to take longer. So it's nothing nuclear that I could quote to you to say, take this amount of time. I'm a big believer in people sort of listening to their own feedback. And people say, no pain, no gain. I say no pain, no pain. Pain is a sign that something's wrong. So pay attention to that and modify your physical activity levels to try and minimize pain. Soreness, okay, I get it, but people recover from soreness, but persistent nagging pain is a sign that there's an issue.
So you should be working out in terms of strength training and getting some muscle soreness in terms of the no pain, no gain adage. Yeah. But if you're having, if the pain is actually limiting your ability to continue to participate in physical activity, if it's nagging, if it's not going away, those are more worrisome signs.
Absolutely. Okay. Yeah, spot on.
There was a question that came in talking a bit about the role of stretching specifically. I think in the exercise or the movement guidelines, you talk about flexibility and balance. Yeah. Can you say a little bit more about a role for stretching, and also maybe what might be some examples with respect to balance and flexibility exercises?
Yeah. It's interesting, stretching has enjoyed a long and very sort of, I'll just call it up and down journey in physical fitness. And, for a long time, you had to do this for static stretch, then it was dynamic stretch. It seems to be that we sort of come kind of full circle, and the effects of stretching on sort of injury reduction and everything else like that are probably not that big a deal. And I know I'm going to upset some people in saying that. I think stretching feels good for a lot of people, and that's why they do it. The balance exercises are around challenging yourself in terms of sort of, it's standing on one foot. It's putting one foot beside the other and in back of each other and trying not to sort of fall over one way or another. Lots of forms of yoga challenge balance. Probably one of the more studied forms of exercise and almost an art form unto itself is Tai Chi. And the poses and the flow and everything is a continual stressor for balance. It's a fantastic form of exercise. Some people say cardiovascularly. I might not agree, but definitely from strengthening and everything else. And it looks artistic besides. And there are actually lots of different forms of or different diseases that have used Tai Chi and to pretty good effect, actually.
Yeah, we often recommend it for patients with underlying neurologic difficulties and with associated balance. And I think there's some evidence of it also simultaneously activating some of the cognitive aspects because of the poses and the positions, maybe.
Right. It's continually changing. And so it's always a challenge. And some of that sort of is incorporated into strength work where you're going from this exercise to this exercise, as opposed to just pedaling on a bike where it's pretty repetitive. And so something that challenges the cognitive aspects of things. But yeah, your point's well taken for sure.
So one of the questions that came in is from somebody who's been inactive for a long time,
Right.
and so I guess, is it ever too late to start? And are there, any special considerations if you've been inactive for a while and maybe you're later in life and you're looking to get back into a higher activity or exercise level?
Yeah. So first, it's never too late. And I mean, we've got studies out there in nonagenarians, so 90-year-old plus individuals where they've made gains in strength and fitness and improved quality of life. And so I always say it's never too late. Start slow, start small, progress gradually, see how you feel. Always do something that you like, because at that stage of your life, if you haven't done it, the chances are is that you're maybe going to be a little adverse to something too drastic. And so don't sign up for something where you go, oh, geez, this is, go for a walk first. Maybe go for a walk. Particularly, I find with people, they walk in nature, and there's another sort of maybe cognitive link with that sort of environment. And I think that that's probably the best way to start.
We had quite a few questions about sort of getting into specific exercises, which I'll ask about in a second. But you presented about sarcopenia, and one of the questions that came in was, can age-related muscle decline or sarcopenia, can it be reversed or slowed down to increased activity and exercise?
Yeah. It can be reversed. It's sort of like, I mean, the trajectory is downward, and it can sort of, you can kind of bend the line up. At some point, aging just happens, and it's going to go down. So I think what we're talking about is more mitigating the decline rather than talking about reversal. But I have heard stories, and we've got data to show that even people in their 60s and 70s are able to gain a little bit of muscle. The net result, into your 70s and 80s, it's going to go down. But it appears that the muscle story is somewhat like the osteoporosis story, and that you want to sort of hit those years where it's going down with a high muscle mass and some good strength, so that you can buffer yourself against the decline. It's the same with bone density going into the menopause with women, is to say, try and build it up to the highest level you can, because it's going to go down.
It may be the same with brain health, and education is, one of the risk factors, lower levels of education for cognitive health. What about the type of weight or resistance exercise, sort of hand weights versus body weights versus squats, anything, bands? There was a question about resistance bands.
Everything and anything works. The gauge we like to use in the facility down here, PACE, the Physical Activity Center of Excellence that I direct, is to say, we have scales on the wall where 10 is red, and it's that's a flat out, I'm exhausted. And we say, try and aim for the orange or the yellow. So it's a 7 or an 8 out of 10. So you're doing it to a high degree of effort. And it doesn't matter whether it's a lightweight, a heavyweight, an elastic band, stepping upstairs, body weight workout. It absolutely doesn't matter. I'm a big fan of bands. I think they work very, very well. The bands that are out there now are excellent compared to the ones even 10 years ago. So anything like that works. Anything where you feel you're having to push and you're getting a strengthening type motion is going to do some benefit for you.
I think you mentioned as well, just there's a lot of body weight exercises. You don't need fancy gym for lunges and squats and things like that, even without weight.
I gave up my gym membership during COVID, and I've never gone back. I do it all in my basement, and it's pretty much all body weight and band work now. It was like I was reborn, and I enjoy it too much there. So.
What about the hype around HIIT, or high intensity interval training? Can you say a bit about that?
Well, I have a good friend and colleague, Dr. Martin Gabala, who is a proponent of high intensity interval training. For some people, it's extraordinary in terms of the benefits you get. Some people don't like working that hard, even though you can do it for a very short period of time. I think one of the things, and my wife always makes this point, is we're going to march slowly in place for 30 minutes, or we're going to sprint quickly in place for 5 minutes. But your risk for something going wrong is greater in the 5 minutes. Which one would you rather do? And everybody's, oh, I'll do the 30 minutes. And I'm like, well, if you say to me, I only have 5 or 10 minutes, then maybe the HIIT work is the right one for you. But the stair climbing example that I gave is really one that impressed me in terms of how little pretty sort of short, high intensity bouts did for these folks. It was impressive.
Do you have any specific advice or general advice, I guess, for people who might have a range of specific health conditions? So you did touch on some of the risk reduction and preventative aspects and benefits in conditions, but we did have a lot of questions come in from people talking about either arthritis or diabetes, and are there any specific recommendations around exercise in those contexts?
Yeah, so anybody with a condition like that needs a little bit of extra monitoring and help. We deal exclusively with, I'll call them, clinical populations in our facility here, and it's not like we check you in and see you later. We have people beside other people and saying, what are you doing? How are you doing it? What's your form? And checking on them, how do you feel? Are you breathless? If you're breathless, stop. And so there's a degree of monitoring that probably needs to happen for anybody that has something that limits them, either, from a disease perspective or a physical perspective. People at the YMCA, if you can find one, do fantastic jobs around, finding classes for people with heart disease, classes for people with type 2 diabetes, classes for people with knee and hip osteoarthritis, and not even that's a homogeneous group, appreciating that everybody's a little bit different. But in all of those cases, we could name a spectrum of conditions. Exercise has always been shown to benefit. So I get it. It's a challenge, but it's worth it in the end.
And any recommendations for people who may be using assistive devices or have mobility issues?
Yeah. So one of the populations that we service here is people with a spinal cord injury. So I don't think you can get any more compromised than a lot of these folks, but they come in and they do the forms of exercise that they can do. So if you can't, if you're, for example, if you're in a walker, then you do your exercise sitting down. There are routines that are geared around those people, and they still achieve benefits. It doesn't require a lot of getting up and getting down, but sometimes it does challenge that. And there are sets of exercise guidelines for people with spinal cord injuries and all kinds of other physical mobility limitations as well. So again, everybody, if they adhere to it and keep it up, they do get benefits.
I feel like we could spend a couple more hours just going through questions, but I'm conscious of the time, and I want to thank you so much tonight, Stu. I am going to share a couple of sort of closing slides, and I'll highlight you and Martin have a great course on Coursera, hacking exercise for health, which I think is one of the most popular courses on Coursera. Actually, you have over 60,000 enrollees there. So for those of you who are not familiar with the McMaster Optimal Aging Portal, we have evidence-based content that can be delivered weekly to your inbox. There's a subscribe button. It's free, and we support evidence webinars as well as other content on the portal. The weekly email alerts will feature online learning modules, videos, alert you to live events like this one, and also include evidence-based health and social blog posts in the weekly email alert. We have a series of video posts, and I think the Alumni Association has posted in the chat the recording of webinar will be available through the alumni's YouTube channel. It will also be posted through the McMaster Optimal Aging portal. We have a whole e-learning series You can access it on the e-learning tab at the top of the menu. And there's a major focus on mobility